So dengue is the most common arbovirus. It's from the family Flaviviridae. The serotypes are DEN1 to DEN4. Recently, the DEN5 was discovered in 2013. So the main two vectors in dengue is Aedes aegypti and Aedes albopictus. In Aedes aegypti, they are nervous feeders. They are more than they have blood meals in more than one individual. They are found mostly in domestic places and are most effective vectors. Whereas Aedes albopictus is a peripheral urban area, and they are aggressive feeders. They complete their blood meal in one go. They're less efficient in transmission. The incubation period is 8 to 10 days. The Aedes pass virus to offsprings by transovarial transmission. The transmission cycle occurs in man and Aedes, which are the principal reservoirs. This occurs in a cycle like from vector to host. The virus again goes to vector and again to host. This is a three factors cycle. So, pathogenesis. Um, so the virus inoculated into human with the mosquito saliva. The virus is localized and replicate in various target organs, which is mainly the lymph node and liver. From these, it's released from these tissue to spread to the blood and infects the WBC and lymphocyte tissue, from which again it's released from these tissue to circulate in the blood. So in secondary viremia is responsible for the signs and symptoms of dengue fever. In primary dengue infection, the first time infection with any of the four types occur. In secondary dengue infection, any of the dengue except the primary infection virus type occurs, because after the primary infection, there's an immunity against the serotype which was affected in the primary infection. So pathogenesis of secondary infection. In primary infection, the host develops lifelong immunity to the homologous, that is the same serotype. In secondary infection, is caused by other three serotypes other than the primary serotype, where the host partially and transient protection is given and high risk of dengue hemorrhagic fever develops. In antibody dependent enhancement mechanism, infection of virus of any other serotypes and there's a production of non-neutralized antibodies facilitates the entry of virus to the monocytes. So in clinical manifestation, so there are three clinical stages: the dengue fever, there's dengue hemorrhagic fever, and there's dengue shock syndrome. In dengue fever, the fever's abrupt in onset, it's biphasic or backbone or sandal fever. There's maculopapillar rashes in the chest and upper limb. The headache is severe. The muscle and joint pain is present. Lymphadenopathy is present. Retroorbital pain is present. Loss of appetite and nausea and vomiting. In dengue hemorrhagic fever, there's high grade fever, there's hepatomegaly, there's thrombocytopenia, there's high hematocrit by 20%, there's hemorrhages, there's spontaneous bleeding from skin, nose, mouth, and gums. In dengue shock syndrome, it's similar to that of dengue hemorrhagic fever. The severity, it's severe without any warning signs. This is a severe type of dengue. So the serotype 1 is followed by serotype 2 in both dengue hemorrhagic fever and dengue shock syndrome. So during pregnancy, prepartum maternal infection occurs that is symptomatic in newborn. The symptoms such as fever, thrombocytopenia, ascites, pleural effusion. So the lab diagnosis, the NS1 antigen detection should be done with ELISA and IFCT, which is a rapid diagnosis test. And NS1 antigen detection from day 1 to 18. In antibody detection, secondary infection, false positive might be possible. MAC ELISA neutralization test. In viral isolation, inoculation into mosquito cell line, which is done for research purposes. And molecular methods, RT-PCR molecular typing for 13 genotypes. Then for treatment, we use vaccine, COID, um, TDV, which is given at the age of 9 to 45 years. It's scheduled, has 3 injections of 0.5 ml subcutaneously for 6 months interval. The contraindications are allergy, reaction in pregnant or immunodeficient patients. So the treatment is symptomatic. The replacement of plasma loss, correction of electrolyte and metabolic disturbance should be done, and platelet or transfusion is if needed.